Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are super excited to have Scott Tips on our show today discussing health freedom and the Health Freedom Network. So, Scott, welcome to our show.
Thank you, Shawn. Thank you, Janet. And as always, it's a pleasure.
So, tell us a little bit about the National Health Federation.
Well, the NHF, the National Health Federation, is more than its name implies. It's actually international. Never got around in the last 70 and a half years to changing the name, though. But it's the world's oldest health freedom organization. It's one that is actually responsible for your ability to take many of the vitamins and supplements that you're taking now, because we saved them from the clutches of the government back in the 70s, 80s, and into the 90s. And we've been involved in a whole bunch of other causes, such as protecting chiropractors from the American Medical Association and the medical state boards. We got them licensed in something like 27 different states to protect them from the state medical boards. And same with acupuncturists and acupressurists. And then fluoride, getting fluoride out of the water is a never-ending job, but we accomplished it in multiple states and local communities. But we've kind of moved on a little bit from the local stuff, although that's super important because these days there's so many smaller health freedom organizations that are focused on particular issues. So one of the things that we've been doing for the last, 27 or 28 years has been weighing in at the Codex Alimentarius meetings, the global meetings that set the world food standards for global trade. And that's really where a lot of the action's at, because most of the health authorities in the various countries, from the FDA and the USDA to the European or Asian equivalents, they have agreed to harmonize their rules and regulations to whatever standards are adopted by Codex Alimentarius. So that's why it's so important. In about, what's today, the 2nd of October. So in about 5 weeks, I'll be going to Rome to attend once again the Codex Alimentarius Commission meeting. This one, what is it? It's 48th session. And I've been going to Codex meetings for 25 years now. And we've been having quite an impact at the Codex level, but that's a whole session right there. And I don't want to take up your time with just Codex, but that's some of it. The other is our lobbyist in Washington, D.C. has been fighting on the digital ID prison. He's been fighting for our health with electromagnetic fields and radiation, stop the 5G and all of this other stuff that is very unhealthy for a lot of people. And then, we've been monitoring like the recent sweetheart deal with Pfizer. We weigh in on these COVID-19 lawsuits that are going on and the research studies that are coming out increasingly proving that COVID-19 has been a very dangerous proposition for anyone who got those injections. And by the way, we publish a magazine called Health Freedom News. It's a quarterly journal. And our winter 2019 issue had as its cover story COVID-19, and telling people not to be afraid of it, not to be stampeded into some useless, harmful remedies. And so I think if we weren't the first to publicly talk about it to the lay people, we were amongst the first. So, we've really been if I can say so, we've been on the cutting edge of a lot of the problems that are cropping up with health and health freedom and the like, and standing in the past to try to make sure it doesn't, get past us to affect, all of you. So that's pretty much it. And I've been the president of the organization for, I think this is my 19th year. It's been 18 years. I'm going on my 19th year. Probably I'll hang it up on the 20th year. They don't retire me sooner. And, but we've been doing a lot of different stuff. So I appreciate you, Shawn, and you, Janet, having me on your program to explain a lot of this.
Well, so tell us a little bit about the history of the Federation, because it started in 1955. Usually there's a reason, an initial reason that the an organization like this starts. So can you give us a little history there?
Yeah. And actually, it's funny that you asked that. If you go to Wikipedia, you'll get a very different view of NHF than if you ask me. Of course, Wikipedia is manufactured consent, times a million. And so we had very unfavorable write-ups written about us. Actually, it was our write-up that was edited horribly by the Wikipedia people who sit on those sites and for big pharma and control the message in the media. And so Wikipedia, you can't believe them, but they describe Fred Hart, our founder, as a fraudster, and a guy who was convicted of fraud and all of this stuff. But it's actually a bunch of nonsense. What Wikipedia says. Fred Hart was a very loving husband. His wife had gotten cancer and he was searching for a cure for it. And about 100 years ago, literally, about 1925, 1924, he found a gentleman named Abram. I'm blocking on his name now. But anyway, I wrote an article about it for our magazine, Health Freedom News. So it's posted on our website. But the gist of it was that this doctor, who was quite famous at the time in the 1920s, and even had a clinic on Trafalgar Square in London, but also throughout the U.S. And he used radio devices. He called it radio at the time. They didn't call it electromagnetic. And he would treat patients, and he had a high success rate. In fact, he had such high success rate, it actually worked on Fred Hart's wife, whom he dearly loved. And so he was quite excited about it. And because of that, Fred Hart founded a nonprofit organization that was called like the Electronic Foundation or something like that. I'm sorry, it's been a while since I wrote the article. And it was to promote this technology. And he had some of the devices at his home. But the FDA came, visited him, two agents came. The old saying, we're here from the government to help you. We're here to help you. So they wanted Fred Hart to explain all there was to know about these devices. And he was very open, in fact, maybe too open and too naive at the time. He thought, this was in the 50s, or was it in the 40s? Anyway, it was before NHF was founded. And he said, yeah, here. And he spent hours with him. He let him go through his books and records. He talked to him about the devices. He was quite congenial with them and just pretty much bared his soul to them about it, how it had helped his wife, and she seemed to be cancer-free. And so they left. And then he didn't get a warning letter like is typical from the FDA for things like this, those days especially. He just got a lawsuit in federal district court. I think it was San Francisco. And before he knew it, he was defending his whole foundation and his practice and all of that. and they reached a settlement agreement that as long as he didn't engage in interstate sales of the device, he could continue doing what he was doing. So that was fine. But the FDA wasn't satisfied with this. They're the biggest hucksters in the world. So what did they do? They found a guy in Reno, Nevada, a chiropractor, who went and visited Fred Hart in his offices in California and said, with a hard luck story, I really need to have a device, and I'd like to do research with it, and it'll really help you a lot because the research I'll do will help show what a great device this is, or these devices, actually more than one device. And Fred Hart said, no, I can't sell you a device. And it kept on and on. Finally, the guy convinced Fred Hart to sell him a device. Well, it was a plant from the FDA. And as soon as he did that, that was one interstate sale from California to the state of Nevada. I think it was Reno or something. And next thing he knows, he's in federal court again. And the judge throws the book at him, takes away all his devices. The ones that have been keeping Mrs. Hart alive are now gone. I think by this point it was, can't remember what year that was, but in any event, she died in the early 60s. And but he was so angry years before that, he founded the NHF specifically to go after the FDA. So we were actually founded by someone who was so upset about the FDA being, and it really opened his eyes to what these government actors were doing. You see it today. I mean, happens all the time. They can lie to you through their teeth. You can't do anything about it. But if you say one false word to them under the law, you can be imprisoned. You can certainly be fined. And so it's not a two-way street in any respect. So in any event, without the device, because she needed the device to keep going, she died, and he was heartbroken. He had already founded NHF by the time she had died, but it was really in reaction to the FDA's actions in 1952, 1953 in taking him before the court for this. So, but I will say the devices did allow Mrs. Hart to live like an additional 39 or 40 years. So they did have some efficacy, a lot of efficacy actually. But that's the reason for the founding of NHF. Now, the last part of our name is Federation. So at the time, it was envisioned to be an organization that was like an umbrella organization for a whole range of individuals, from individuals, consumers, medical practitioners, non-medical practitioners, retail health food stores, manufacturers, the whole range. And for about, I'd say 35 years, we were the only game in town, maybe 40 years, we were the only game in town. If you wanted in America or even Canada to fight for health freedom, you went to the NHF and you joined us. But with the passage of Dietary in October 1994, there were a whole bunch of splinter groups, and we had a battle, an internal battle in 1989, 1990 that's, kind of shed some members and some leaders, and they went out and founded their own little organization. But so that took us down a notch or two there. And then with Dietary, everyone wanted to be the big frog in the little pond. They didn't want to work with us so much. They just set up their own organization and went from there. So now today you'll see every Tom, Dick, and Harry with their own health freedom organization. Some of them just founded yesterday, others about 10 or 20 years old. But we're the oldest one and still hanging in there. And I rather predict in 70 more years we'll still be around when a lot of these others aren't. But, the funny thing is a lot of these other ones are good organizations. They're doing a lot of good work. They tend to be at least more focused on particular issues like vaccines or water fluoridation in the public water supply or things like that. But more power to them. That's what it takes. As our former president said, all of us are smarter than one of us. And we're lucky to have them around. So anyway.
Explain what the Shay is. I'm not familiar with that.
Oh, I'm sorry. I should have said the full name. So that's the Dietary Supplement Health and Education Act, DSHEA. And a lot of the people refer to it just as DSHEA now, rather than say DSHEA or Dietary Supplement Health and Education Act of 1994. And it was passed by Congress unanimously in the Senate, which is a little ominous right there, but on October 15th, 1994. But it took a lot of work by NHF, by Natural Products Association, which at the time had a different name, and a lot of the retail stores acting on their own, a lot of individuals. It wasn't just NHF that helped get it passed. It was really a lot of other people and organizations, too numerous really to mention. And but it was a compromise bill. So it has a lot of flaws in it, but a lot of the industry, the health food industry, they treat it as kind of like a Bible, like, oh, don't touch DSHEA. And they have some good reasons for that, because if we ever open it up to amend it to make it better, there's the risk that it'll be worse, sort of like
Right.
the U.S. Constitution and the Convention of States. If you ever hold that, I pretty much guarantee you won't have the Constitution anymore. So they have legitimate reasons to fear, reopening DSHEA, but it's operated. What DSHEA basically did is the Nutrition Labeling and Education Act of 1990, which had been passed in that year, obviously, was a very, very pro-FDA legislation. And basically what it was going to do, it's turning all supplements into food additives, where you would have to prove that they were safe and effective before you could market them. And to do that could cost millions of dollars. It's like proving a drug, the efficacy on a drug. So what would that do? That would remove a lot of the supplements that we were counting on at the time, myself included, from the market. So that created a firestorm in America. And I remember it because I was working with NHF that long ago. I mean, that was, 35 years ago. And we were all concerned about it. And I'm a food and drug lawyer. I was one of the first two food and drug lawyers west of the Mississippi. And so I had clients who were supplement companies who were quite concerned about this. But everyone came together, came up with the Dietary Supplement Health and Education Act, pushed it forward. There were more letters written to Congress about DSHEA than any other legislative package or any other event since the Vietnam War.
Wow.
Taken the Vietnam War was the only one that surpassed it. And you had a lot of people, at that time, a lot of the health food companies, even the corporate ones, were run by people who were really dedicated to health freedom. Now, a lot of these companies are owned by pharmaceutical giants, and they're run by people who are bean counters. They could be selling shopping carts for all they care. It just happens they're selling supplements. But back then in the early 90s, certainly in the 80s and 70s and 60s, you had a lot of people who were true believers They were doing this because it was their passion. They believed it would help people's health. It would keep them from getting cancer. It would keep them from getting sick. Or if they were sick or had cancer, it'd help heal them. And so they went and fought with a ferocity that you wouldn't believe. And that's why it was unanimously passed by Congress in 1994. Now, the problem was, to get it passed unanimously, it had compromises. One of the compromises was that October 15th, 1994 date was set in stone. All supplements on the market before then were grandfathered in, didn't have to be subjected to food additive type standards. Those introduced into the marketplace after that date did, but it wasn't supposed to be the NLEA, that 1990 act I told you about, wasn't supposed to be that act's high degree of and very expensive degree of proof. It was just supposed to be, you would write a letter to the FDA, say, in 75 days, I'm going to be marketing this product. It consists of this, this, and this new ingredient. It's called an NDI, new dietary ingredient. This NDI, and then the FDA, I'm sorry, it wasn't 75 days. I think the FDA then had 75 days to respond. And if they didn't respond, you were okay to market it. Well, the FDA in most recent years has flipped that on its head with its draft guidance document to the industry, the health food industry, saying, oh, you've got to prove a lot more than that. And they're trying to, by a backdoor way, go back to the 1990 law. And so in 2007 or 11, in 2011, I think, I came up with the idea, well, let's just have an amendment to DSHEA where we move that October 15th, 1994 date to a later date. And our lobbyist at the time, Lee Bechtel, said, well, Scott, it really needs to be January 1, 2010 or something like that, because that's when they put in the GM, the Good Manufacturing Practices amendments and stuff like that, and we could justify it. But if we just could move that date, it'd be a very simple bill, probably a 1 or 2 page bill that would say the date, the DSHEA of 1994 is amended to, with respect to the October 15, 1994 date, to January 1, 2010 or 7, whatever we had at the time. And then that would, in one fell swoop, have grandfathered in about 30,000 new dietary ingredients. And we wouldn't have this big mess that we're having now with the FDA. So, but kind of looping back to what I told you before about the industry being reluctant to open up DSHEA, because then they'd want to tinker with other parts of it. Never got any support from the industry. And a lot of the health freedom organizations didn't support us either. Some did, but many did not. So it didn't go anywhere and it died. But I still think it would have worked without jeopardizing DSHEA. And that's where we're at. So we're at this stage right now. The FDA is trying to, and the USDA, when it comes to food, is trying to backdoor a lot of stuff by harmonizing or saying that it will harmonize its rules and regulations for supplements and foods to those of Codex Alimentarius. So that's our big battle. We're the only health freedom organization fighting at the Codex level. When we first were doing that at Codex in 2000, year 2000, June 2000, that was the first meeting I went to in Berlin for the nutrition committee. We were laughed at, we were ridiculed, we were sidelined. And then when we got accreditation, in fact, I was just a member of the US delegation. I couldn't speak out at the meetings. In fact, you know what, Shawn, Janet, you had to sign a contract I, Scott Tipps, agree not to take a position contrary to that taken by the United States government on any issue at Codex, and will not lobby any other organization contrary to the position taken by the United States government.
Wow.
And you have to sign that to be on the delegation. So all you could do is argue with the FDA head of delegation. In that case, at that time, it was Elizabeth Yetley or Beth Yetley from the FDA, and have a story there, but it takes too long to tell you that. But in any event, 2 years later, they wouldn't let me back on the delegation because I was a troublemaker. So I was very motivated to get accredited status for the National Health Federation with Codex, which would allow us have our own microphone, speak out at the meeting just like any other country would, well, nearly so, submit written documents, interact in real time with the other delegates. Like if I wanted to go speak to the Egyptian delegate, I could get up from my seat and go over there and kneel by his table and chat with him while things were going on. So all of that, or email him or whatever. So and we got in. Surprisingly, and then they found out what an incredible mistake they had made, and they tried to kick us out about 5 years later, but they didn't succeed. And then we had our first major victory about 7 years after being accredited, a huge victory where we stopped the nutrient reference values for vitamins and minerals from being set at these absurdly, ridiculously low levels. Like they wanted to lower vitamins. NRVs are basically the RDAs, but at Codex level. So the nutrient reference value for vitamin C, the daily value, it was at 60 milligrams, but the Australian delegate thought that was way too dangerous. 60 milligrams a day of vitamin C, gosh, people go nuts on that stuff. So we've got to lower it to 45 a day. And they were lowering magnesium from 300 milligrams a day to 220 a day. And they were increasing stupidly, because these are twin minerals. They go, together. Calcium from, I forget what it was, but up to 1,000 milligrams a day. Well, you don't ever want to get your ratio of calcium and magnesium out of whack like that. You'll have a lot of free-floating calcium. It's going to calcify your arteries and give you wrinkles in your face and all of that. You need magnesium, which is the traffic cop that tells calcium where to go, along with vitamin D and vitamin K2, tells it where to go and gets it out of your arteries. It isn't cholesterol in your arteries that kills you, it's calcification. Calcification is hard. The cholesterol is very soft, and it's a very minor component in the arteries compared to calcification. Anyway, so I made all these arguments. The argument, mainly with Australia, but a few other countries, went on for about an hour. And bless his heart, the chairman, whom I had really not been very fond of, he allowed the arguments to go on. I only had support from 2 countries. One was Iraq, believe it or not, who spoke up in our favor. And the other was India. And they were so clever. They did it at a very critical time, just when the chairman was on the knife's edge of making a decision, and the Indian delegate pushed it in favor of us. And the chairman said, look, we're going to hold these back for further study. And it took another 5 years. See, they thought they were going to sail through this 8-step process of adoption and get vitamin C at 45 milligrams. Oh, they were lowering all the B vitamins down, except for folic acid. They were lowering all the B vitamins down by about 22% across the board. And it was just a basic nightmare. I was fit to be tied when I read that document during the break just before the discussion. I hadn't been aware that they were going to do this because I was focused on some other issues at that committee. but we were able to stop it, and it totally killed the momentum. And after that, they never regained the momentum, and we were able to get. Now we argued for, which is still low, but 500 milligrams a day for vitamin C. We had to be practical and think, well, what will work? At a Codex meeting, we can't claim 1,000 or 2,000 a day, so we'll shoot for 500. Well, we got 100. So we just turned the dynamic around by arguing more than we knew we'd end up at. Well, we were hoping 120, but we got 100. And then a lot of the B vitamins were left at their current level. We lost on the magnesium calcium thing. We would have won on the selenium, but the stupid, naive EU delegate threw in the towel. And if she had stood her ground on the EU's designation of 70 milligrams, we were never going to get 200 micrograms. But she threw in the towel on the EU's position of 70 micrograms, and we ended up with 50 micrograms a day, thanks to the US delegation that said it should be 50. Generally at these meetings, Shawn and Janet, if you go to these meetings, you don't know a thing about what's going on there. If you just listen to the Anglo-Saxon delegates speaking, Canada, the United States, New Zealand, Australia, and you take a position about 180 degrees opposite of theirs, you'll be on the side of good health and health freedom. If you go along with what they say, especially Australia, which is, the demonic Satanists, in my view, because they're nothing more than a regional branch office of the pharmaceutical industry. And they've never met a healthy standard that they didn't oppose or an unhealthy standard that they didn't push, whether it's GMO labeling, whether it's the NRVs, the nutrient reference values, whether it's the ractopamine and zilpaterol drugs that they give to animals to fatten them up for slaughter, but have very ill side effects for the animals, and residue levels that trigger effects in humans. So they're all for these kinds of things. So that's what we've been doing all these years, quietly in the background. And I have to tell you, one of the reasons I appreciate programs like yours, Janet, yours, Shawn, is because we're NHF, we're our own worst marketers. We don't really go out and talk much about ourselves. We have our magazine, we have our website. Thank you for showing it there. We're updating our website, by the way. And we're just so busy with our heads down to the grindstone, our faces to the grindstone, that we're just working away and not thinking, oh, maybe we should let the world know what we're doing. And so we're trying to change that.
Well, thank you. Thank you for being on, and thank you for sharing what you guys do. This will never go away. The topic of medical freedom, health freedom will never go away. So we definitely need organizations like yours. So thank you for being on today, Scott.
Thank you. Yeah, it's like Winston Churchill said, victory is never final. We had that victory in 2009 on the nutrient reference values, but you still have to fight the battle. We still have to fight the battle with the FDA. The thing we really have to look out for these days is not to get corralled into the digital ID prison that they're building around us, even as we speak. Because once they do that, what will happen is like what happened to 60 plus million Vietnamese just last week, where they didn't sign up for their digital ID in Vietnam. So suddenly their banking accounts disappeared. They had no more banking accounts. And that's what they can do with this digital ID and control over our finances, knowing every little bit about what we do. And a lot of people, and I'm sorry to say it, but even RFK Jr. is touting the wearables, and they'll have the glasses with the augmented reality and so on. They already have them, but those are big, huge data gatherers on our personal habits, and they'll use that information against all of us. So that's our big battle right now that we need to fight, amongst others. And we need to get the message out. Pay cash. Don't pay with a card.
That's right. That's right. Well, thank you so much for educating us on that. Our goal is to educate and empower individuals to take charge of their own health. You've helped us realize our goal, Scott. So thank you so much.
Thank you. And may I give our website, or will you give it on the?
Go ahead. I'll stream it again and tell me about your website. What is it?
It's we couldn't get NHF.com, so we got the NHF.com. Evidently, NHF.com was already taken at the time. And so what you're looking at right now is the homepage. And there's some videos there in the lower right-hand corner that talk about Codex. They're short videos, so they won't take much of your time. And then we're a little bit behind posting a lot of the articles from the magazine. But if you're a member of the organization, you get your own portal to go in and look at the most current issue of the magazine. That, in fact, we had one come out just at the end of the summer. And I'm currently working on the fall issue, which should be out, honestly, probably in November. I have too much to do on the Codex meeting for it to come out in October. So that's it.
Awesome.
And, yeah.
Well, thank you. Thank you for being on our show today, Scott, and educating us. Go ahead.
Thank you. And one last thing, if I may. I don't know how much time we have, so I don't know.
We're running out of time.
Okay. So once a month, third Friday of every month, typically, we have a Zoom brainstorming meeting. And I encourage people sign up on our e-list, because then you'll get a notice of it. And we usually have a lot of good speakers. It's just once a month. And we've had some really good people on there. So you don't have to talk, but you do, if you want to, have a chance to ask questions of the guest speakers. So thenhf.com, sign up on our e-list, and you'll get notice of the next meeting. It'll be the third Friday of this month, October, that we have the next one. I'm not sure who's going to be on it, but
thank you so much, Scott.
Thank you both for having me on.
And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Monday for our regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Thank you.